The following program was recorded earlier for rebroadcast at this time.
The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host.
And we do welcome you to another edition of Ask the Experts here on AM 700 KSEV, the voice of Texas. And good afternoon. I'm Jack Gonzalez. And in this particular session, we're going to be talking about home health and hospice care. And the man we're going to talk about that with is Felix Canabal with Avatar Home Health and Hospice. Thank you very much for joining us on this Ask the Experts session. Felix, we certainly appreciate having you on here.
Thank you. It's a pleasure to be on the air again to talk about Avatar Home Health and Hospice and anything else that might be of interest to our audience.
And so let's give the folks who are just tuning in, I know you've been with us several weeks and months, and they've...
Wait a minute.
Years.
I'm going on my second year.
Yeah. And I was going to add that in there. Excuse me for shortchanging you that on Felix, but yes, you've been... And the business itself, and that's what I was going to get to, has been around for longer than 2 years. So why don't you give our listeners a little background as far as Avatar Home Health and how you came about it?
Yeah, so Avatar Home Health and Hospice started at sometime in 2006, and we got certified by Medicare and Medicaid in 2007. At that time, we also received the Gold Seal of Approval by the Joint Commission, which is the agency that inspects the home health agencies and the hospitals and the doctors in the whole United States, so that when you get the Gold Seal of Approval, it's something that is really very special. Only 9% of the agencies in Texas have received that Gold Seal of Approval. So when I talk to a doctor and say, well, our agency has received the Gold Seal of Approval from the Joint Commission, they want to talk to me because they know that our agency has to be one of the very best.
And to get this Gold Seal of Approval, you have to go through a rigorous inspection. You know, they just show up at your door and boom, you have to stop everything and provide them with whatever they want. And you don't get any pre-notion that they're going to be coming in. They just show up and you have to show them your records and how you run your facility in order to win that award.
Correct. When the very first one we got in 2007, we knew that it would be 3 to 4 months after we applied. They showed up without notice, of course. They went through our records and what have you. And because we were a new agency, they couldn't really find anything wrong with us. So they gave us a temporary approval. And then, of course, we started getting more patients and getting busier. And then 4 months later, they showed up unannounced, and then they checked everything that we had done with those patients that we had admitted, make sure that everything was good, and then they gave us our permanent accreditation. And then they do it every year. Whenever they want, they stop by and they do a survey, or an inspection. So far, we've been, getting all these inspections from the Joint Commission, and this is what's going on now for 14 years, or close to it, since we've been in business. And every time they come, they might find some paperwork that they don't like and that we need to adjust. But as far as the care of the patient, they have never found anything that we have done wrong taking care of the patients. Of course, the most important thing.
And this is something they do yearly, correct?
No, our agency has a really good record, so we hardly ever get a complaint. So they look at that too. If you're kind of an agency where they have a lot of complaints, or they've been there before, and you've been kind of shaky and you had to fix a lot of things to get the approval, then they might come more often. In our case, they will come every 3 years, because every time they come, they find nothing wrong with the agencies. They got us in the A list,
So since you've done so well in your inspections, they don't see the need to come out as often, as opposed to maybe other facilities where they've had problems in the past and they say, well, let's stay on them and make sure that they continue, because that's so important these days, Felix. We see a lot of news regarding some home health services, some attendants to come out, see some bad news out there about that. And that's why we want to let our listeners know about this, because of the fact that when you put a loved one under someone else's care, you may worry a little bit about how that's going to turn out. And, because you do care for them. And to give our listeners the satisfaction of knowing that you guys will take care of people, and it's not just you saying it, but you've got the approval, the certification.
Right, and also we have, our reviews are I mean, they're, they go through the roof. Everybody, not everybody, but all you can listen to the reviews or look at the reviews that we have online. A lot of patients very, very grateful to us, to what we've done for them, or relatives. And I mean, this is all up there in the internet. And not only that, it's a repeat business that we get. We have had patients, and we have the patient, and we have the sister, then we have the uncle and the father, and before we know it, I have a family that they have like 4 people from the same family have gotten services from Avatar Home Health and Hospice.
Well, that's going to make you feel pretty good to know that, so many people within that own family say, hey, he took good care of us. I mean, that person,
right.
And they want him to take care. And by the way, before we continue, let's give out your contact information. I just realized we hadn't done that. So the phone number, and you mentioned the website as well earlier.
Right. My phone number is 281-703-8050, 281-703-8050. And the webpage is Avatar, A-V as in Victor, A-T as in Thomas, A-R, homehealth.com. So it's avatarhomehealth.com. And the number I gave, that 281-703-8050, Jack, as you know, that's my personal cell phone.
Yep, I definitely know that.
I only have one cell phone, and that's the same number that my family calls me on. If it rings, I answer it, no matter what time of the day. Doesn't matter what day of the week. And like now, for instance, like if it rings now, I'm not going to answer it because we're doing the show. But as soon as the show is over, I'll answer all the phone calls I got. So, very few people, like actually last Thursday or Friday, I was talking to a new patient-to-be, or the son of the patient, and he was with a different agency. So he called me, and they were talking. I said, where can I call you back? I said, this number. He says, yeah, but I'm going to call you back after work. I said, well, I'm going to answer it. And he says, oh, your office open to that late? I go, no, this is my cell phone. This is my. And he was kind of surprised. And then he didn't know I owned the agency. So he says, oh, so you work 24 hours a day? I said, I do. I'm the owner of the agency. And then I explained to him that all the patients have my number, and they can all call me. And Jack, people, my friends think I'm crazy because, we take care of about 400 patients. We have patients in home health. We have patients in the hospice department. We have patients in the provider or caretaker department. And all of those patients and their families have my cell number. So people think that my phone is ringing off the hook 24 hours a day. And the fact, Jack, is that I don't get that many phone calls from patients because of the quality of care they receive. We have wonderful nurses, very professional therapists. Our home health aides are very compassionate, very sweet. They take really good care of the patients. So basically, I mean, normally when people call a business, it's because they want to complain about something. And with us, those phone calls are almost non-existent.
And Felix, let's go into a little bit more detail as far as the care you provide. You do the nurses come to the patient's home, and you do the cooking and the other things involved with that. Why don't you go into a little bit more detail for some of our listeners who have not heard that part before?
Sure. So basically, when you talk about Avatar Home Health and Hospice, it's like if you were talking about 3 different agencies because we're licensed to do all these different services. Normally, an agency is either a home health agency or a hospice agency or a provider agency. So we're 3 in 1. So a patient that let's say is getting a caretaker now, and that caretaker goes to his house or her house, 1 to 3, 5 hours a day, depending on what is needed. And again, and 3, 4, 5 times a week, and they do the cleaning, they prepare light meals, they help the patient take a bath, they do the laundry. So they help them in their everyday needs, and the little things, the chores that 10, 20 years ago they could do by themselves, but now they're old, they're sick, and they need help.
And
so
go ahead. I'm sorry, I didn't know. Go right ahead.
Oh, right, yeah, that's one side of the agency. That's the provider or caretaker department. But let's say that one of those patients need a nurse to go out and see them. So then the home health department, with the nursing side, can go ahead and help them, but they're still dealing with the same people. You see? So there's a continuity of care that they cannot get from most agencies in the Houston or actually in Texas. So there's a continuity of care that is so important. You don't want to be, if you have a provider with one agency, then you need a nurse. You have to be dealing with another agency. And then, if your patient goes into, like, say, hospice, then now you need dealing with another agency. So you're having all these new people coming into your house, and you have to, build up the relationship again, and maybe you like them, maybe you don't. But with Avatar Home Health and Hospice, we take care of you. We take care of the provider department, in the provider department, in the home health department, and in the hospice department. Whatever you need, you don't have to be searching for other companies. And that's super important, Jack.
It saves a lot of hassle from having to go from one department to another and go online. Then you have to, of course, our listeners would have to check them out and make sure. So since they already know your work, they don't have to worry about doing all that. And Felix, we're going to take a quick break because it's our time to step away for a minute. And when we come back, we're going to talk more about Avatar Home Health and Hospice Care. And also in the news these days, unfortunately, is the coronavirus. And we're going to talk about how Avatar will help you and your family member deal with that. So stay tuned. I'm Jack Gonzalez. That's Felix Cannibal. And this is Ask the Experts on AM 700 KSEV, the voice of Texas.
Do you or anyone you know need help with your daily activities? Grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And welcome back to Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez, and we are talking to Felix Cannibal of Avatar Home Health. And when we left off, Felix, you were talking about your home health care services.
Yes, as I was saying, in the home health department, that's what we do, the nursing. We have physical therapists, occupational therapists, speech therapists. We take care of patients with almost any need that they have. For instance, we just admitted a patient with an infusion going on because she needs to take antibiotics. She has a catheter. She has another bag for her kidneys. So this is a very complicated case. And the reason that the patient came to us is that they were with another agency, and the other agency started doing the infusion. And when the patient had to go to the doctor, and the doctor started her with the catheters, the other agency said, no, we cannot do the infusion, and the catheter is just too much. So the doctor called us, and we took over the case. So again, our agency, we're one of the premier agencies in Houston as far as taking care of wounds. All our nurses have been trained in taking care of the wounds, using what is called a wound vac, which is a machine that you attach to the wounds so they heal faster. So any difficult cases can come to us, and we'll be more than glad to help the patient. And the main idea for home health is, number one, of course, take care of the patient, make him better, make him comfortable. But our number one mission is to keep that patient from going to the hospital. That is the main reason home health exists. Because if there wasn't home health and the patient needed this, they would either have to go to the doctor every day or they have to end up in the hospital, especially now with this coronavirus. If you go to the hospital for something that is not like an emergency, you have a broken bone or something like that, they're not going to take you. They're going to tell you to go and wait another 2 or 3 weeks. Right now, doctors are giving you appointments for 5 or 6 weeks from now because they don't want to see people during the coronavirus crisis. So that is why it's so important to be able to get the care you need at your home. And that is what home health is all about. Like now we have some people that are afraid that the nurses might bring the virus into their homes. No, we're very well prepared. We know all the precautions that we need to take. Yet the same people that don't want our nurses to go home have relatives that are going in and out of the house every day with no protection. 2 weeks ago, a patient of ours that had declined the services because he was afraid of the coronavirus, I talked to him and I said, well, but we're taking care of you because you have other issues going on that might also kill you. And he said, no, the coronavirus. So I said, fine. Say, when you need us, call us. So he called us last Tuesday and he says, well, where's my nurse? I said, well, Mr. So-and-so, you asked us to stop the services. So I'll get a nurse out there tomorrow. This is like just crazy, Jack, hard to believe. Our nurse showed up there about 10 o'clock in the morning. Their wife is there crying. The patient died about 8:30 that morning.
Oh, no.
Yeah. So it's very important that you do not stop taking care of your other issues because you're too concerned with the coronavirus that you forget that you have high blood pressure or kidney failure or anything else that might be going on with you. You still need somebody like a trained nurse to help you, even if she only goes there once a week.
And that's the thing, Felix. So we've mentioned before in our previous shows that the nurses not only come to provide you the care that you need then, but they are also watching the patient, seeing if there's anything going on differently that hadn't been happening before. And if there is something happening there, they'll, as you said, you work with the doctors, you'll let them know and say, hey, we noticed when we went for our last visit, the patient did this or didn't do that like they're supposed to. So that's another reason why it is so important, as you mentioned, Felix, that your patients don't stop the care because of just that reason right there.
Yes, and unfortunately, the panic that is out there about this virus, obviously this is a very serious problem.
Sure. We're not saying that either, as you mentioned, because it is very serious. We've heard about the deaths and everything, but as you said, though, don't stop the care. And who knows, you might be showing symptoms of the coronavirus, and the nurse can say that as well, too, and bring it up and say, hey, we need to get you some medical attention.
Right. So, again, that's why home health is so critical for patients. And then, of course, Jack, we also have the hospice services, which that's for the patients that have a terminal illness, and the doctor is of the opinion that the patient has approximately 6 months or less to live. And those patients, we go and we provide them not only with the nursing, but we have visiting doctors, we pay for the medicines, we pay for all the medical equipment they need, we pay for all the medical supplies they need. They get an array of services like social workers, which are actually counselors that have been trained to deal with these end-of-life issues that the patient and or the patient's family might be facing or are facing. They also get a chaplain in case they want a spiritual need, and they used to go to church every Sunday or to the temple, and they cannot go anymore because, now they're sick and they cannot get out of bed or they just don't feel well enough to be going out. So we provide that service to, again, home health, hospice, provider or caretaker services, whatever the patient needs. If they call us at 281-703-8050, they can talk to me, and in about half an hour, I can get them qualified, and that day or the next day, we can have a nurse at the patient's home to do an evaluation.
And Felix, since we've been talking about all these great services, a lot of people are wondering about paying for it. And we were talking previously as well regarding this, the insurance. You can help people as far as getting their insurance and finding out what you guys can cover and what you can't cover. In changing insurance this time of year as well, too, that's a big thing that people sometimes think about as well, too, correct?
Correct. Well, actually, and I'm glad you brought that up, because our services are not completely free, but the patients don't pay us anything. In other words, we're going to check with Medicare or Medicaid or the insurance company, and they're the ones that are going to pay for our services. We never, ever send the patient a bill for anything. Of course, let me make a pause here. Now I'm talking about patients that are over 65 or patients that have Medicare or they have a Medicare plan. So any of those patients that we see, we never charge them a penny. Medicare or their insurance companies are going to pay for all the expenses. Now, for those patients that are younger and they say they have group insurance or they got other kinds of insurance, but they do not have Medicare, we still work with their insurance companies, and then they might have a deductible or a co-payment. But in reality, Jack, 98% of our patients are Medicare patients. So we can help other people too, but our main source of patients is Medicare. Then they might have a deductible or a co-payment. But in reality, Jack, 98% of our patients are Medicare patients. So we can help other people too, but our main source of patients is Medicare.
And that is certainly good because I'm sure, like I said previously, a lot of people are wondering about that. Yeah, well, how much will it cost? Because you are providing a lot of great services, as we said, not just the home health care, but the hospice care as well, too. Now, before we do close, we do only have a few minutes, Felix. As you mentioned, of course, a lot about your nurses. You're always looking to hire new nurses and therapists as well, too. So why don't you put out a little shout out for that for some of our listeners who might be interested in this type of work?
Of course, sure. Yes, we need nurses. When I say nurses, we need good nurses. If you're compassionate, if you really, really want to establish relationships with patients where you're going to see them once a week or twice a week for a number of weeks, not like in the hospital where you see a patient and in 3 or 4 days a patient is discharged, if that long. So you might see him during your shift, but then you don't know anything else about this patient. And that's what's special about home health. For the nurses and the therapists that work in home health, you get to know the patient and you really get to help them get better. And so that is critical. It's also, you have very flexible times because we provide you with the patients and you work your schedule out with the patient. So, it's the best of both worlds. You make excellent money in our agency. I can only speak for Avatar Home Health. We provide you with the patients, we provide you with everything you need, and then you can, depending on the program that you sign up with us, you can work for us and receive health insurance, retirement, etc. You get benefits depending on how you want to work with us,
And is there certain areas that you're looking for the nurses and the therapists right now, Felix?
Yes, right now we're looking for nurses to take care of patients along the I-69 route, say from Humboldt all the way to Cleveland. We need a nurse to cover that area. We need nurses to cover like the Pasadena, Pearland, that's the southeast of Houston area. So those two areas right now are the ones where we need the most nurses right now. But even if you don't live in those areas or close to those areas, do call me at 281-703-8050. We can set an appointment. And even if you live someplace else besides those two areas, we can go ahead and get you going. We give you the training that you need for home health. We really prepare you for the job that you're going to have to do with the agency. And believe me, we have nurses with us, Jack, for 10 years, 8 years. So if nurses are with us for that long, think particularly with all the options that nurses have. A nurse is never going to be unemployed unless she wants to, because if she leaves a job today, she can go down the street and get another job because, as you know, nurses are, we are very short in nurses, not only at the agency but the hospital level, especially now with the coronavirus, So the nurses can go any place they want to and get another job, and yet they prefer to stay with Avatar Home Health and Hospice.
Well, Felix, it's certainly been a very informative time with you. Like we said, speaking about all the important, great services that you folks at Avatar Home Health and Home Health Care and Hospice provide. So I'm certainly sure our listeners appreciate that information because, as we said in the opening, home health care is a very big thing these days. So thanks for joining us for another edition of Ask the Experts here on KACV, Felix. We certainly do appreciate it.
Thank you for having me.
And we certainly thank our listeners for tuning in. I'm Jack Gonzalez, and this has been Ask the Experts here on AM 700 KSEV, the voice of Texas, and we'll talk to you next week.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.